Hello and welcome to the Tinnitus Matters podcast, where we talk about all aspects of tinnitus. My name's Phil Holmes.
And I'm Christine Nixon. And today, Phil, we have a very special guest.
I believe so.
Mr. Saravanan Kasirajan, who is an ENT consultant surgeon at Lancashire Teaching Hospitals. And he has a specialist interest in paediatrics at the hospital.
Excellent. Thank you very much for coming. We
Thank
do
you.
appreciate how busy you guys are at the moment, so we do really appreciate you taking the time to come and explain and talk about tinnitus within within paediatric setting, etc. So my first question, if that's okay, is how does tinnitus manifest itself in children compared to adults?
Thank you, Phil, and thank you, Christine, for the introduction, and thank you for inviting me to this show. Tinnitus manifestation is usually the children don't come in saying that they have tinnitus.
Yep.
You have to ask the question proactively to the kids, and a lot of the kids will say, yes, I have it intermittently, occasionally. That's what the answers they give in. But very few subsection of the children will come primarily complaining of tinnitus, which is very, very rare because tinnitus doesn't bother them so much. So they don't say it. So you have to ask the question,
Right.
usually, to say whether they have tinnitus. And in very young children, it's very difficult to ask the question as well because they don't understand it clearly. So it has to be explained in a proper way to bring about the symptom they have. But tinnitus is not the primary manifestation most of the time in children. They usually have other problems associated with the ear rather than tinnitus. So tinnitus has to be asked as a question, as a leading question
Yes.
to the children to bring out the answer rather than saying them saying that they have something like a sound happening in the ear.
So within adults, the tinnitus can sound different between different people. It can be a buzzing, it can be a whooshing, it can be a ringing. Is that the same in children, or is it a different? Do children experience a different sound?
No, it's practically the same kind of sounds they
Right.
experience. When tinnitus, I think studies have shown that there can be up to 10 to 12 different types of sounds which people can hear. As you rightly said, ringing sounds, buzzing sound, whooshing sound, pulsatile sounds.
Yes.
There are different types of sounds which people can hear. And it's the same in children, what applies to adults. It's not different from the adults. And there's not much of a difference between them and the children.
Can I ask,
Yeah.
Saravanan, what are the potential causes of tinnitus in children that, when they come to you clinically, in the clinic, what are the reasons why they are experiencing it?
Most of the children, when they come into the clinic, they usually come in with some kind of ear-related problem, which is in the form of ear infections, ear discharges, or hearing loss. And when you ask a question to them, additionally, do you have any noises in the ear? They come out and say, yes, we do get it occasionally. A lot of the children don't come in saying that they have tinnitus, even though studies have shown that tinnitus can happen in children with completely normal hearing without any associated ear symptoms. But that subset of children having tinnitus as a primary problem is very, very rare compared to children having underlying pathology in the ear, like I explained before. So it's usually hearing loss or ear infections or any ear pain, associated symptoms. And when you ask a question to them, they'll say, yes, I do get it occasionally, doctor, which comes and goes. That's the usual answer.
And is it similar to the adult side?
It is more similar to the adult side. And adults on the other hand have tinnitus without any underlying ear symptoms,
Yes.
but children usually have underlying ear problems, which is associated with tinnitus.
So you can almost look at treating and managing
Yeah.
the ear issue problem, which indirectly helps the tinnitus?
That's correct, yeah, because when a lot of the children, like a majority of the children when they're growing up are susceptible to ear infections and what we call as glue ear, which leads on to hearing problems. And when we treat those conditions, most of the tinnitus usually tend to go away and then tend to disappear. So it's a very, very treatable condition. And that's what they say when children complain primarily of tinnitus. When they say that, oh, tinnitus is a problem for me, then most of the children need to be investigated thoroughly for underlying what we say autoneurological conditions, which basically means any pathology in the ear or in the brain. So you need to check for it thoroughly before we say, okay, There's no other problems. It's just tinnitus, and we'll kind of try and treat your tinnitus. So most of the children are associated with underlying ear conditions, which need to be looked into.
Yes.
In comparison to adults. Like if you check adults, a lot of the adults with normal hearing will come in with tinnitus, and you don't see any other problems. We still try to investigate the adults in respect to tinnitus, but in children it's far more important to investigate because they're more likely to have underlying problems with either the ear or the brain.
It's interesting, isn't it, Phil? Sorry, another podcast we did about additional needs. It's looking for the cues, isn't it, in certain patient groups?
It is, and it's interesting that adults will come and say, "I've got a ringing in my ears, and that is why I am here."
Yeah.
Whereas children don't come to you with that.
No.
And
But when they do,
Yeah.
you need to intervene.
That's correct. Yeah, the children, particularly younger children, never come to the clinic saying that they have a problem of ringing in the ears or buzzing in the ears. It's usually older children, starting from the teenage years.
Right.
They're the ones who can come into the clinic. In my personal experience, I've seen a couple of teenagers, particularly girls, coming into the clinic saying that tinnitus is the primary problem, which I investigated and found no reason for the problem, and I have to reassure and discharge them. But it's usually the teenage group of kids who come in complaining of tinnitus. Younger age group never come into the clinic saying that. I've never seen a child less than 10 saying that tinnitus is a primary problem.
Interesting. And of those teenagers, how do they say it affects them? Is it affect concentration? Does it affect sleep? Is it anxiety? Does it
Schooling,
contribute to
education, how does it impact?
Surprisingly, children cope really well with the tinnitus compared to the adults.
Right.
It's like if you, for example, I do perform a lot of surgeries, and if I do a tonsillectomy on a child, the recovery for tonsillectomy for a child is so much better in terms of pain. They tend to tolerate the pain so much better.
Right.
But when you do the same surgery in adults, they complain bitterly, saying that, oh my God, how severe the pain is. I didn't expect the pain to be so worse. And children, for some reason, tend to cope with the problems much better compared to the adults. And same way, when it comes to tinnitus, they tend to cope better. They tend to do really well. But some children can come into the clinic complaining of anxiety, some kind of fear that there's something wrong with them. But studies have shown the most important problem children face is sleep disturbances. They struggle to sleep.
Right.
Because of the noises. They're concentrating on the noise. When everything goes quiet outside, they can hear the noises in the ear quite badly, and they struggle to sleep. That's the most important problem they come in with to the clinic, saying that they can't sleep well compared to anything else.
And obviously sleep's incredibly important, and especially if they're going to school, then that will in turn affect concentration and affect other things as well. So
absolutely, particularly crucial times like when like teenagers, when they're doing their GCSEs or A levels, and when they can't get to sleep and tinnitus is an issue, then they start to seek help because it's affecting their studies, affecting the performance at school or college. So they come to the clinic saying that, what can we do for it? So that's when they usually come in to us to seek help.
And what would your answer be?
The answer will be, I'll say to them, look, I know you have tinnitus. I need to go through a checklist of what are the problems you have. I need to examine your ears. I need to investigate by testing your hearing. And if necessary, I need to send you for further investigations in the form of scans. And then based on that, we'll see if there is any other associated problems. If there is none found, then I say to them, look, you don't have anything to be concerned of. Tinnitus should settle down on its own because studies have shown that it's very, very rare for children to carry on the tinnitus into adulthood.
That's really reassuring.
That it tends to kind of fizzle out as time goes by. So the key is reassurance to the child or the adolescent, saying to them, the tinnitus is going to get better, and you need to kind of take your mind away from tinnitus and calm yourself down. But if they can't calm themselves down, then one of the important things to consider is referring them to a child psychologist. If everything from the ENT perspective is clear, refer them to a child psychologist to help them deal with the sleep issues and also to inform them about coping strategies. So I think pediatric audiologists, what they can do is they can help them with what adults have, something called as tinnitus retraining therapy, in which they kind of help the child to get habituated to the sound then the tinnitus doesn't become a problem for them in the future.
Yeah, and sound therapy and
And
audio in the background,
sound
waves.
therapy, those kind of things. Like
think-
mostly counseling, sound therapy,
Yes.
which helps them in the future.
I
to
think
kind of-
what you're saying is that children are a little bit more willing, easier to take, should I say, on the sound,
Yeah.
rather than adults. We get a bit more cynical, don't we? We get a little bit unsure, and is it going to work?
Yeah.
Whereas with children, if you're saying as they can grow out of it,
Yeah.
it's almost like they accept face value. It will help.
You're absolutely right. The children tend to accept their problems much better, but we always say in pediatric clinics, it's not difficult treating the child, it's difficult treating the parents' expectations.
Oh, interesting.
Yes.
The parents
Yeah.
are so concerned, and that's the problem. And because
Yeah.
the child is precious, obviously, to any parent, and the parents become so anxious, so worked up, so worried what's happening to the
I'm
children.
guilty with that, to
Yeah.
be honest, with
Yeah.
my own children. So
So children tend to take up their treatments better. The children are happier. They kind of understand it. Like the couple of teenage girls I've seen in the clinic, they were absolutely fine once the explanation was given, once the investigations was done,
Yes.
and the reassurance was given to them. They're fine. But the parents had tons of questions to ask me to see whether this is not going to be affecting the child. And one child had to hold the parent back, saying that, "Mum, stop asking questions."
It's almost
She was
feeding the
embarrassed.
problem, isn't it?
Yeah.
I see.
Yeah.
Yeah.
So in terms, we were just talking there about potential help. So once we understand that it is only tinnitus and it's not hiding something else, or
Yeah.
there's nothing else present from an ENT perspective, is there a role for hearing aids with children to help relieve tinnitus, or would we not necessarily go down that route with children?
In children, it's a little bit difficult to prescribe them hearing aids for tinnitus. They tend to cope with the tinnitus better compared to adults. So we usually don't have to go down to the route
Right.
of hearing aids. They don't go to the extent of needing a hearing aid for the tinnitus.
Unless
Some
there's a significant loss.
Yes,
I
unless there is a
imagine.
significant hearing issue, because
Yeah.
a lot of the children with what we call classify as sensory neural hearing loss need hearing aids.
Yes.
And those children will benefit from hearing aids, which will eliminate tinnitus
Yes.
and also improve their hearing.
Yes.
Those subset of children will definitely benefit from hearing aids. But children with normal hearing, if we prescribe them hearing aids, they will be highly skeptical about it. They don't want to be seen as having a disability, particularly in
Embarrassment.
college or school, because they're going to be picked on. So they don't like to have hearing aids. So they tend to take the advice more compared to the adults, and they kind of tend to move forward. But there are some children who can be very, very difficult to manage in spite of a lot of the psychological reassuring, child psychologists. But in spite of that, they still might be troubled by tinnitus. And those children might want to try a hearing aid. In that case, we always say, okay, that's fine. We'll give you a hearing aid.
So leading on from what you're saying there, how can a parent help a child emotionally cope with tinnitus?
It's about strong reassurance, explaining to them what has been explained to them in the clinic, that you've been seen by the doctors.
Okay, so
they have given you,
repeat.
the reassurance and give the emotional support. The child usually sometimes can distress, and patience is the key with the parents.
Patience.
So the parents don't need to get upset saying that, oh, you all are, not be dismissive, because a lot of the parents can sometimes say, oh, your doctor has said, what's your problem? Why are you still complaining about it? Because it's a child who's going through the symptom, and if the child is explaining the symptom and being distressed about it, being patient, being calm, and reassuring the children again and again and again, and being very supportive is going to help them in a long way. And that's what the parents need to do, rather than dismissing it and saying that you've been given all clear by the doctor, you don't need to complain anymore. Those kind of things has to be avoided.
Excellent. And what kind of role within children would kind of ear infections have, or exposure to loud noises, or does even family history come into tinnitus at an early age?
Most of the time, family history is based on the nerve type of hearing problem they have. So some children born with decreased hearing without any other associated ear condition,
Right.
what we call a sensorineural deafness, in which the inner ear gets affected and they can't hear properly and they can get progressively worse. And that can be passed on genetically from parents.
Right.
So we need to screen, and the parents as well. When the parents have a hearing issue, we need to screen the children for a hearing problem. If the children have hearing problem and if the parents don't have it, we need to ask about any other relatives in the family has had hearing issue, and most of the time there is.
Right.
Or sometimes they don't have to be, but a lot of the genetic hearing loss is passed on from the parents to the children, and those type of children will have tinnitus, and the parents would have experienced tinnitus as well.
And am I right in thinking that some children, they may have, concentrated on the children with a potential hearing loss,
Yeah.
recognise they do have a sensorineural hearing loss, as you were saying. The parents didn't know they had one, but you screen them, and you go, oh, well, you've got a hearing loss. Does that happen?
It happens because when children have a very mild nature of hearing problem, they don't express that they have a problem with the hearing, because the hearing problem usually gradually gets worsened. And what the children do is very good in adapting to the amount of hearing problem they have. So they get used to it. They kind of concentrate a little bit more, and they don't express it otherwise what happens is when the performance at school starts to slowly, gradually decline because they can't hear properly to the teachers, so they can't work out the solution for a problem, and then it starts to reflect in the performance. And that's when usually we always start to think, is there an issue with the child? Is the child can't see properly, can't hear properly, what's going on? And that's when, those are the cues for us to investigate further to see if the children have a hearing loss. And if the parents have had a hearing loss, children don't say that they have a hearing problem, and they have to be screened. If not, they will be picked up at some point in the career in the school when the performance starts to fail academically.
It's so interesting, isn't it? I mean,
The different levels and layers. And so what advice would you give to any parents who are feeling quite overwhelmed with their child's diagnosis of tinnitus in the clinic, and the child may be distressed, or it might be that the parents are distressed? What advice would you give them?
The advice will be based on what the underlying diagnosis is associated with tinnitus. If the child has an associated ear infection, then it's easy. Treat the ear infection and the tinnitus will settle down. If the child has a glue ear with the hearing problem, then again, it's a very simple problem. We know that the glue ear is going to subside as the child grows older. If the child is really struggling, then we give appropriate measures in the form of either hearing aids or grommet insertion, and the tinnitus is going to improve once the hearing problem gets sorted out. The only issue comes in when the child has a sensorineural type of hearing loss, which obviously the tinnitus is not going to go away completely. It's going to be. So they say about 35% of the kids with a nerve type of hearing loss have associated tinnitus.
Right.
And those are the kids will have tinnitus continuously. But what happens is habituation happens, and the child tends to start to live with the tinnitus, and it doesn't become a problem in the future. But those children are most likely to have hearing aids as well, and the hearing aids tend to mask the tinnitus coming from within the ear. So that's not going to be an issue. The only issue is when children have normal hearing and have tinnitus. Those are the ones we need constant reassurance. Explain to the parents, look, we have checked everything, we've done the appropriate investigations. Your child has normal hearing. There's nothing abnormal in the ear or in the brain. So the tinnitus is going to go away at some point in the future. We don't know when. But be reassured that this is not an issue. This is not a problem. This is not a pathology the child is going to have forever, and the child is going to grow.
And this is where you emphasise the relaxation strategies and distraction strategies,
all
over
the coping
time.
mechanisms.
We
give the coping mechanisms, and the child cope. And surprisingly, children are very, very resilient, and they tend to cope better, and they tend to grasp the situation better. They tend to distract themselves, and they have a lot going on in their lives. They're quite active, unlike us when we tend to think about a lot. They don't have much to think about or worry about. They just want to enjoy life. So they forget about tinnitus fairly quickly.
Just one of my final questions, because obviously we're based here at the University of Central Lancashire, and my question's around research. Are you aware of any research into kind of paediatric tinnitus moving forward, or any advancements or is there anything that you would like to see a research project kind of investigate?
There's been plenty of research going on in the background in terms of treating tinnitus in children, but nothing has been particularly fruitful in terms of medical management or any other type of management, except for tinnitus retraining therapy in those ones who are affected by tinnitus. Even though there's tons of research being done, they're all kind of not very productive in terms of translating into effective treatment strategies. So it's a very difficult area. And the second problem is children don't come forward with tinnitus like adults do. So it's very, very difficult to do research. So some of the research which has come out in publications is mainly proactively going and asking kids, do they have ringing in the ears or buzzing in the ears? So the tinnitus don't come out. So that's how they found out in children with normal hearing, different papers have quoted 7 to 47% of kids had tinnitus in the ears, but like they were all intermittent, they were not bothered by it, so they just kind of like they were not concerned by it. But children with problems in the ears or the brain don't complain about it. But if you ask them, the percentage is slightly higher. Up to 56% of the children will say, yes, we have tinnitus. So the research has shown when asked proactively about tinnitus, the children say about tinnitus. But because the children presenting with tinnitus is so sparse and few, it's very difficult, I think, for research to happen, particularly for children coming forward with tinnitus as a symptom.
But even, I guess 56% of people asked is still quite a high
Quite
figure.
a high number, yeah. It's more than what we think.
But like you say, if it's not bothering them and it's not interfering with their day-to-day life, you almost don't want to make it a problem.
Yeah.
But it's knowing the true figures of how many it's bothering, really, which is hard to ascertain.
Yeah. When I might, for example, in the clinic, I might ask a question to the child as a part of the routine history taking. Do you have sound coming from the ear? A teenage child will be able to grasp it quite easily and will say, okay, it happens occasionally, or it does not happen. But if you ask a 7-year-old child the same question, they might not understand it. They're not interested, they're playful. They might say, it might happen occasionally. But you don't know whether it happens or not in a 7-year-old child. But it's very, very difficult to ascertain whether they have tinnitus or not.
You can't measure that.
You can't measure that. So it's very, very difficult to say unless otherwise the child. Sometimes the children do express to the parents when it happens. Oh, I have ringing in my ears. Oh, Mom, I could hear something, or Dad, I could hear something. So the parents might say it, yes, or the child would mention it. But if the child has never mentioned it, if you ask a 6 or 7-year-old child, it's very, very difficult to know whether the child is saying the truth or whether the child is saying it to satisfy you. Because the children have a tendency not to upset older people.
Yes.
So they might just give an answer to satisfy.
They think you want to hear.
Yes. So that's what they do.
So the key, what I'm getting from all this is that actually information to help the parents cope.
Yeah.
And to help them to support the child, really.
Yeah. But if the child comes primarily with tinnitus, then obviously once we ruled out any of the particular concerns with the ears or the brain which might bring out the tinnitus, then it's going to be a case of strong reassurance for the parents. Educate them and say there is nothing problematic with the child. The child will grow out of it. You just need to distract the child when the child complains of tinnitus and not make it as a big deal. Because in children, when you kind of say, oh my God, you have tinnitus, oh, what's it? They start to panic. The children will start to panic. But the parents need to stay calm and distract them. And the children get distracted quite easily and they'll forget about it very, very quickly. So that's the best way to go forward.
Excellent.
Well, that was really interesting, Saravanan. Thank you so much.
Really, really interesting.
Yeah, and thanks for coming on the show, talking to us and our listeners.
Thank you, man. I'm so pleased I invited me. I'm happy to share my thoughts with you guys.
Yeah,
thank you so much. Thank you.
Excellent. Take care, and yes, we will hopefully see you soon.
Yeah.
Hopefully see you soon. Yeah.
Thank you very much.
Thank you.